Good afternoon, Enid. It's Maggie Jackson with the Garfield County Health Department, and I brought some guests along with me today. You might have seen her before with the City of Enid, but tell us how long you have been working for the Garfield County Health Department, Diana.
So, yes, Diana Hernandez here, and first day working for the Oklahoma State Department of Health, and I'm super excited to be on board. And I am the Public Information Officer, and I'm so glad to be a part of this awesome team.
Great. We're so glad to have her. On her first day, she's getting hazed by me having her come along. So I'm so glad you're here. And we also have John Gray. John, tell us what you're doing with the health department.
I am the case tracer for the state. And basically what that means is I get to help people assess where they are with COVID and letting them know how long they should quarantine themselves and things of that nature.
That's great. So if you have a positive test from COVID-19, you may actually get a call from Mr. Gray here. So thanks for coming with me today.
Thanks for having me.
I'm just going to jump right into a quick update about COVID-19 in our community. In our county, we'll start just a quick slide. The data is getting reported a little bit differently. If you're one of those who loves to check up on the state data, it might look a little different. But our cases have gone down. You can see our little graph right there. We are looking better since the beginning of November, but at the very end, you see a little uptick again. What we're looking at as fall comes on us and it's colder temperatures, people are gathering indoors, and we are seeing more people getting exposed to COVID once again. We have 86 active cases right now. It's an average over the last week. And so there is still COVID-19 in our community. We have not seen many recent deaths, which is fortunate. So please keep that in mind as you go into the holidays, that when you're inside, when you're gathering, there's the possibility of spreading germs, just like every year, but this year we're still watching COVID. I did want to let you know that we have seen a lot more people getting a COVID-19 vaccine. Across the state, we're at 72% for people over 12 have had at least one dose. 60% are fully vaccinated. Here in Garfield County, they're at the top, 64.6% have had one dose and 55% are fully vaccinated. So I just want to thank you again. If you have gotten your COVID-19 vaccine, you are part of the effort to slow down this pandemic and keep people from severe illness and potentially dying from COVID. So we're still offering COVID-19 vaccines. I want to reiterate that you know, the Delta variant, we saw that wave come through, and we did have people test positive after having a vaccine, but they were 5 times less likely to test positive, 10 times less likely to go to the hospital, and 10 times less likely to die. So we are we're seeing the vaccines do what we thought they would do. So. Just recently, the FDA has authorized under Emergency Use Act the Pfizer vaccine for children 5 to 11. This is a completely different vaccine. It's not a different vaccine. It's the Pfizer vaccine. It's a different dosage, is what I meant to say. A different dose for kiddos based on their smaller weight, and they need 2 doses just like adults, 21 days apart. And we can take any walk-ins at the Garfield County Health Department. So especially if you have a young child that is has something that makes their immune system compromised, or they live with an older family member. You know, we love that our kiddos are back in and out of school, but when they come back home and they might be around their grandmother who is higher risk, or a parent that's higher risk, having that children vaccinated protects those family members as well. So we recommend that, and we are taking walk-ins every day. If you're off school, come on by and we'll get you a vaccine. Again, booster doses are available for everyone now, everyone over 18. So if you're over 18 and you've had 2 doses of Moderna or Pfizer vaccine, you can come in for a booster dose 6 months later. If you had J&J or Janssen, you can come in 2 months later. So everybody over 18 is eligible for a booster now. And just again, reminding everybody, you can walk on in at the Garfield County Health Department. If you would like to make an appointment just to make sure, that's our phone number, 580-233-0650. And there are lots of other providers getting vaccine out there in our community, our pharmacies, our hospitals. It is readily available at lots of locations. So, wanted to talk about this week. It's honestly my favorite holiday. I just think there's so much less commercialism around Thanksgiving. It's just a day to be grateful, and I have a lot to be grateful for this year, especially with the pandemic. This time last year, it was ramping up, and I'm hoping we see less cases this year. So I wanted to turn it over to Diana and John and talk about Thanksgiving.
Yes, so we are days away from Thanksgiving, and according to NPR.org, in a recent survey, more than 50% of Americans are planning on gathering in homes with 10 plus people. So, John, how can we approach the Thanksgiving still in the environment of COVID, where we can welcome family in and keep COVID out?
Well, the basics remain the same. The washing your hands, wearing of face masks, and covering your mouth when you have a cough. If a person is exhibiting one or two signs of the possibility of having COVID, like coughing or feeling very lethargic, then perhaps they might need to rethink about going, especially if they're going to be going to a home where there might be an elderly person that'll be a little more compromised because of age and maybe some pre-existing conditions. But basically, wash your hands, be safe. If you don't feel well, it's best to just not participate, and maybe you can go online and have maybe an online Thanksgiving celebration with your family, especially if you're not feeling well. It's not the same as eating a nice big turkey leg, but better to stay at home than to possibly infect one or two or more people.
Now that doesn't, so if you go to a gathering and say everyone is healthy at that setting, but if you go back out to real world, your work environment, grocery store, you could possibly always be mindful that you could possibly always, put others at risk too, so be mindful of that too. Right.
One of the things I think is important for people to remember is that you have an incubation stage. And if let's say you are feeling sick today, chances are you may have been exposed 2 days prior to feeling ill. So you want to keep that in mind. If you're around someone, if you're out somewhere and you notice that a person keeps coughing, perhaps you should have a mask in your pocket and just wear it, just to be on the safe side. And it's not about being told what to do. It's more about being safe.
Awesome. Thank you for sharing that with me. Do you have any other thoughts that you want to include, Maggie?
Thank you guys so much. I just know last year we were really trying to stay separated. This year, I hope that with those recommendations that we can gather safely. It's not too late to get a vaccine. If you're vaccinated, you are less likely to spread the virus, but you still can. So we want to watch for those symptoms, still take precautions. Get those kiddos to wash their hands. I know mine we're working on it. We're pretty good now. So thank you. I hope that you all enjoy time with your loved ones, and we're hoping lots of folks visit Enid this weekend too. I know my kids have been ice skating already for hours. We love the skating rink, so we're really excited about all the fun events this weekend. What should we think about when we are, having visitors coming from out of town? I think we want to make sure that when you've got all those people in a crowd, that we still try to stay separated. If someone's coughing, watch your symptoms. Don't come if you're sick. That's an easy one. That should be an easy one all the time.
It'll be hard in a situation where there's a lot of people, but try to stay within that 6 feet distance, and in 15 minutes, if you're around someone that is coughing, try not to be in their presence for more than 15 minutes.
Yeah, that sounds good. Yeah. Thanks. Well, we wish you all a happy Thanksgiving, a great start to the holiday season, and please don't forget, it's not too late to come get a vaccine, come get your flu shots. Those things will help us continue to celebrate holidays, continue to stay together, and enjoy our time without being sick. So happy Thanksgiving.
Thanksgiving.
Bye.